Reliance on a static image in a dynamic environment can make nodule biopsies using lung navigation technology challenging. You need confidence throughout the procedure to know where you're at and that you're on target. Introducing ILLUMISITE, the first system that puts the power of precision in your hands.
CT to body divergence is a challenge because it's really keeping our physicians away from the ultimate success that they can have in a procedure. There's a myriad of reasons why it occurs. One being, we're going from a static environment when the patient receives the CT scan prior to procedure to a dynamic environment when they're on the table during the procedure. We also know that patients face anesthesia challenges. Thirdly, as we're putting that bronchoscope down that airway, the tissue distortion happens. And we were really trying to focus in on what are the biggest challenges and how we solve for them. When I think of ILLUMISITE, I think really about the next generation of our company and how Medtronic is innovating in the lung health space.
Fluoroscopic navigation enhances visibility of the lesions and gives us alignment to the target. Until today, navigation systems rely on using a virtual road map to help us get to the nodule. What we did with fluoroscopic navigation is we said, hey, there's a C-arm over here. Let's take that C-arm and let's rotate it around the patient. Let's take that two-dimensional data. Let's build a three-dimensional volume and let's enhance nodules so we know where they are. So if we have the ability to know that we're in the target with a high degree of confidence, that's going to be impactful for the procedure, for the physicians and the patients. It gives us an opportunity to biopsy the nodule like we never have before. So continuous guidance gives the user real-time feedback. We embedded a sensor in the distal tip, and at the same time we maintained the real estate inside that channel. What that does for the user is it allows them to know where they are with a improved accuracy of what's happening once a biopsy tool is placed down that working channel. We know that most cancers are not homogeneous in nature. So multi-directional sampling gives us the ability to sample not only in the center of the lesion, but to sample all around the lesion. And I think this is pretty exciting. The cross-country transbronchial access tool allows our physicians to go beyond the airways. Not all airways are visualized when we look at a CT scan. And so having the ability to understand that there is an option to go off-road, to go off the airway, to gain access into the parenchyma of the lung is pretty amazing. Now, having the ability to use near real-time imaging, correcting for CT to body divergence, adding continuous guidance, and we have the ability to access lesions beyond the airway. That's really the powerful package that ILLUMISITE brings to the market.
I think the exciting part about the data that we're seeing is really giving us confidence that fluoroscopic navigation technology is working. We've seen physicians embark on their own studies and seeing tremendous success. One study in particular saw a 25-point increase in diagnostic yield with the use of fluoroscopic navigation technology. An early study showed us that in 95% of the cases, the virtual target overlapped the actual nodule lesion, and that gives our physicians confidence that they are where they think they are. Our clinical studies are so important because it's really proving that the technologies that we're bringing to market actually work, and they're providing a benefit far and above what we even thought was possible.
This is how you biopsy with confidence. This is how together we lead the way in lung cancer care. This is a new era in lung navigation.